Within the category of research into clinical practice, we were looking for impact on service delivery. Howls Health Scheme is a collaboration between the Health Board, the Council, Public Health, the University, Industry, Tata Steel, and the pharmaceutical industry. It's a screening programme for cardiovascular and type 2 diabetes. It's for the members of staff of the Health Board and of the Tata Steel. It was changing the way the dietitians work with individuals. So really about looking at the diet and the needs of the individuals and their lifestyles. Bipolar disorder programme is for patients with bipolar disease and their families. So it's a collaboration between Cardiff in the Vale University Health Board, Cardiff University and Betsy Cadwallader Health Board. This collaboration has developed a programme of 10 sessions, but also an internet programme so that patients and families can access this information. This has had an impact not only on education, but also for the patients and their families to understand the disease and actually cope better with their disease. This project from an RM Bevan University Health Board focused on specialist seating for children with disabilities. It actually asked children what they thought about their wheelchairs that they use for activities of daily living. It was about asking them themselves what they thought of their seating and their ability to do everyday living similar to other children. What did it give to the children themselves? It gave them confidence in themselves. It gave them confidence that people were listening to them. It also made them feel valued. I'd like to say congratulations to all the finalists. They all demonstrated the importance of research, using those research findings and making that change over into practice, into patients' care, and also impact on the families.